Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk to you this morning about bonded blocks and how do they work in orthodontics, and a similar thing are used in mouth guards and splints and all sorts of things that help you in working with the jaws and the way the jaw comes in contact with the condyles up here into the retrodiscal tissue. And this is something you have to protect. That's a very soft spot in the body for damage that can really bother you. So let's start working on this. This is a young man that has very little to do with the bonded blocks. There are several other things wrong with this young man's teeth, the way he swallows and the way he breathes. And he is a mouth breather, and we'll have to cover all this stuff as we go through. He's got a lot of this regular orthodontic problems, which we cover in many videos. You see the man's upper lip is very short here. So he's holding his mouth open quite a bit at a time, and his tongue doesn't stay in the roof of the mouth. It kind of stays in between, and so both jaws don't develop as much as they should. And he breathes in over the tongue, and so this is a problem we have to deal with. I don't have the slides on this young man that finishes his case up, but we'll go far enough to where you'll understand what we're doing here with this. Let's go to the next picture of him. You don't see his mouth open as wide, but you can see the teeth that are crooked. The laterals are behind the centrals. He has cross bites, and here, so he's got a bunch of just simple orthodontic problems that many people have. And a lot of people straightening the teeth don't think about all the other things that are associated with this. Now, the jaws are not wide enough in here. You see these bicuspids, both upper and lower, are inside further than they should be. So we're going to have to widen this out and make some room for the teeth to fit in there. That's one of the things that we have to do. And we'll have to jump the bite. In other words, his lower lateral is coming up past the upper lateral. It is going in between the lateral and the central. Similar over on this side. This one is behind, but it's in front of the tooth down below. The cuspids are rotated badly, and there's several things wrong here. But the main thing I want to talk about is what we're going to build the blocks back in here to open this bite big enough so that we can jump the bite back here and bring these laterals far forward right here. Let's go on and look at some other things here on the case. And it will take me a few minutes to do this. You just can't do these case presentations in 3 minutes, and so a lot of people are just thumbing through this, but you can look at it as a minute. But if you want to really see what we did here, you need to spend some time with it, and you got to learn it. Now, the upper teeth are biting cusp to cusp on each other here. So the upper arch is not as wide as it should be, and even the lower arch is not as wide. So he holding his mouth open, he's keeping the tongue kind of in between the teeth, and the jaws don't widen out like they should. And then this lower jaw is fitting in here, and it's got a lateral tooth that looks like something else in there coming up in between the upper lateral and the upper central tooth right here, which locks this jaw in a certain position. He's got a rotated cusp down there on that side. Let's look at the other side of the mouth, and also let me point out with this green line, we've got a curvous fee in here. We're going to have to level this thing out as we go through this. So on this side now, we have the same thing. This curvous face like this, and this helps. This is in a class 1 relationship, though. The lower molars out in front of this, so we don't have to move the jaw all that far. We've got a cuspid in place here. There's a second bite, first bite, and the cuspid coming in here, hitting the lateral on the lingual side, and this cuspid's coming down there. Now, as we look at the model from the side, this really needs to be out like something like this to have a better, and then bring this back in just a little bit. And as you do that, you'll widen it out, you'll make room for the teeth to come in, and that's what we would hope to do in the case. The lower is a little bit more narrow than it should be, but it's still where the upper cusp, you can see where the upper cusp kind of hit on the lower cusp down here, instead of the lower going in between the molar here. It's hitting the upper cusp, or hitting cusp to cusp down in here. So we're going to have to widen both jaws to do this. This is a badly rotated tooth. We didn't use the best method of rotating that, but I'll show you that in a little later down the line here. All right, to jump the crossbite, we had to bond some blocks on these teeth back in here to open the mouth up so that we could bring these teeth through this gap and jump them over on this side. So we're enlarging the space here, and we'll be pulling these laterals forward, or pushing pressure on them to bring them out, and we'll be straightening up this. And this is done with a little flimsy arch wire, and this cuspid, we're opening space for it to come through there. Now, we bonded these blocks in this particular case to give us room to bring these teeth across this area right here. Looks like we don't have we do have the bonded block in there right now. You can see it on top of the teeth right in here, and we'll have it on the other side also. And if you haven't done this and you want to know how to bond these, we've got several videos showing you how to bond them, how to take them off, and you don't bond them with anything but just plain acrylic, and you etch the tooth, and you put some liquid in this etched part of the top, the occlusal surface of the molars and bicuspids, and you bond the block in there. Or you can put the bonded block up here in the front part of the mouth on some cases, where you want to increase the vertical length of the lower third of the face. You bond it in the anterior. If you don't want to increase that, you bond it back in this area, and this will put the force right up in on the bone structure in this area. And that's one reason for wearing those things. All right, we have this little flimsy wire in, and we're just pulling these teeth in position. And you see the arches need to be widened out, something like this. And that'll bring these cusps out over the lower, and you can widen the lower just a little bit in order to match it, make it match up. Now, here are the bonded blocks. You don't need to wrap it around the teeth at all. You just etch the occlusal surface of the teeth here. Wash it and dry it and get it etched good. And paint a little liquid in acrylic into this with a brush, and you can mix this stuff up and get it thick. Put a little string of it over here and a little string over here, and you have them close their jaw in the place where you really want the jaw to close, and then let them just sit there for a little bit while that hardens, and you put some lubricant on the upper teeth to keep them from sticking to this naturally. And you don't want to do this out of some material that's so hard to take off. You cut a groove down through the middle of it, and then you just grab it on each side with a plier, and you can press it, and you can pop one side off, and then the other side is easy to get off. So you can take them off and put them on easily, and that opens space up. So we've got room here now. You see, we've got to turn this tooth. It looks like 90 degrees rotated. You bring it back in here. This one's rotated a little bit. It opens the gap for this to bring through. These are the things that we'll do, and the bonded block opens this and allows us to have room to bring that out. Now, if you put a bonded block in the anterior part of the mouth, the load goes from these teeth back to the condyle, back on the back of the part, and then on the posterior teeth back here, the load goes right up between the teeth and into the bone, and that's where your mouth guard and all these other uses for, I think every kid should, everybody really doing any contact sports of any kind should wear a mouth guard. It keeps the condyle from being jammed back into the fossa and jammed into this retrodiscal tissue, which really would give you trouble. Like you get hit in a car accident, you pop your head back and it knocks this condyle into that area, and they'll have trouble with their jaw joints for a while. If nobody helps them, they last for a long time. So let's, I'm going to erase that, and we'll go on. Now we've gone in and put some heavier arch wires in there and start straightening this up, and we've got these teeth lined up now, and they're in there, and we're going to be working on the bottom of cuspids, rotating these. The next view, we've got this tooth rotated now right in here. I think there's a view here where you can see how we did that. Now, this is where we had to open this gap, bring this tooth out, and then line this all up, and we're going to increase these sides long enough to bring those teeth in. Now here, this is pretty well done. See, we've spread this out. Now you can spread it with a big daddy arch wire. We've got a rectangular wire in here. Just remember, as you spread this out, your molar teeth up there, I'll just kind of draw a little indication of these molar teeth. If the molar tooth has got roots that are going in kind of, it's at an angle, it's even worse. And you've got to put buccal root torque so that you bring these roots out. As you expand the crown, the roots tend to stay in where they are. So you need to put buccal root torque in there. In other words, your bracket on this side would, let's say we have a bracket slot right here, and we want to put this torque in. We want these roots to come out in this direction here, so we'd have to bend this wire something like this, and you flex it, bring it in here, and the wire is constantly pushing this way to bring the roots of the teeth out as you expand the crowns of the teeth. You don't want to leave the root back there, because the root actually, if you push this over and don't bring the root will go this way while you bring the crown, and that cuts down the airway additional amount. So learn how to put buccal root torque. If you widen these out with a big daddy arch wire, or if you go in there with a palatal separator, you can widen it and have it cemented real good, and it'll bring the roots out two. But don't use a palatal separator with a bar on the teeth and just something banded or bonded onto the, welded onto the 6-year molar. It'll bring the roots out, but it won't bring the other roots out. These are things that you need to remember when you're going there widening these dental arches. Now we came down on the lower, here it is. We use a different way to rotate this tooth. Personally, if you want to rotate, turn this tooth around this way, it was almost 90 degrees. See, you want to rotate it in this direction right here. You hook a chain, a little deal with about 4 circles on it. You run it on itself over here, wrap it around this tooth, and you have to put some acrylic on there to keep from sliding over the top. Wrap it around this way, come underneath, and then hook it to the bracket over on this side, but not go over the arch wire. That is the most efficient way to rotate a tooth like that. This does it to some extent. Right here, we needed to pull it back anyway, so we ran it underneath and hooked it on that, and it pulled the tooth around. This one was easier to rotate, and we're using those little wing brackets. We think it's starting out like that, it's best to use those. It helps you rotate. Later on, you might just use the single bracket by itself, but we use the wing brackets on the lower. The upper, we may have used the other brackets, and we'll band the molars back here in the back too, in the case. So let's get on now to the next. Now, I didn't get the finishing part. I never could get him back and get the pictures that I wanted to, but we widened both arches in here, and we're going to have to do a little midline correction. One side over here was class 1, the other was kind of a little class 2-ish. So we'll look at this. Now we're getting pretty close. We're in class 1. We've got the upper widened where the cusp of the lower teeth will go into the groove on the upper teeth, and this keeps you from biting your cheek on this side of your mouth. And I've got a mouth breather, and I didn't get that done, and I bite my cheeks all the time. And then we had to bring this back in and line the upper overjet and overbite and work it out here. Now, this is the lower, and here was that cuspid tooth, you see, and we had to turn that thing almost 90 degrees to get it lined up in here. And so I would say hook your chain, wrap it around the cuspid, come over here and hook it onto the bracket, but don't hook it, go over the arch wire. Keep it. Keep watching the ink deal now. So I don't know what they put that up there for. I'm going to try to get it out of there. We're going to keep these deals. And now I'm going to have to go back into this. All right, we'll finish this up now. And so we've lined that tooth up, and we've expanded the whole thing. I've got to hit another button here, and it pushed that along. Then we'll go back to this. Okay, we've got the teeth lined up now, and we widen these a little bit, but the upper cusp now, the upper teeth come down, and these teeth go in the groove of that and come back up. I did something here, I'm not really sure what. Now, all right, we straightened this side out and brought it out too, and here is the last picture I've got on that young man. He is a mouth breather. So if we widen this palate out far enough and you open the airway and get him to breathe right. He's got a little short lip right here, and he needs to bring that lip down. He can lengthen it by just pulling it over his teeth like that. When I had my teeth straightened, the doctor that Dr. Gillespie had me pulling my lip down like that, and now that I got grown, you hardly see my upper front teeth. That's a smile, big, and this looks much better in making a lips down. You look like you're smiling more than maybe you are. This is the last picture I got on him. I couldn't find the rest of the case, but we carried it on to finish there. And so I hope you get something from this on bonded blocks. They protect the teeth, they protect the jaw position in mouth guards. I'm going to make a video on mouth guards. Everybody in any type of contact sport should be wearing mouth guards. So when you get hit, you bite you, and it doesn't put the force back on the condyles. It gives you such a problem if you bruise the retrodiscal tissue. Thanks for watching, and I'm going to close up now, and we'll see you again in another video. I want to say I thank you very much for watching these videos. There's a lot of things wrong with orthodontics, and I'm trying my best to get as many of them straightened out as I possibly can. And I hope you will help and pass this on to your friends. I thank you for subscribing to this. We have a lot of people that have subscribed to it all around over the world, and I appreciate you writing and sending me notes, and we'll try to answer as many of them as we can. And I thank you again. I'm going to say goodbye and close this out.